Good morning, what brings you in today?
我發燒、打冷震、成身骨痛、咳嗽得好嚴重、喉嚨痛，我成日都覺得好攰，尋日開始頭痛。
Have you had any associated upper respiratory symptoms, such as runny nose and nasal congestion?
有，我啱啱唔記得講，我夜晚個鼻塞得好嚴重，朝早就流鼻水，我個喉嚨吞嘢嗰陣會更加痛。
Productive cough or dry cough.
大部分時間都係乾咳，但間中會有啲清痰。
Have you noticed any difficulty breathing, shortness of breath, or chest pain?
冇明顯氣促，但如果咳嗽得好勁嘅時候，會覺得胸口有少少唔舒服。
Have you experienced any gastrointestinal symptoms such as nausea, vomiting, or diarrhea?
我有少少反胃，但冇嘔亦都冇肚瀉。
Any chills or diaphoresis accompanying your fever?
有，我間歇性打冷震，夜晚仲出好多汗。
How high has your fever been?
尋晚大約燒到39度，我食咗泰諾，之後退咗少少。
Do you have any known immunocompromising conditions, such as diabetes mellitus, chronic obstructive pulmonary disease, or a history of malignancy?
冇，我平時身體幾健康，冇咩長期疾病。
Have you recently been in contact with anyone exhibiting similar symptoms?
有，我有個同事上個禮拜不停咳嗽同發燒，不過佢有戴口罩同喺佢自己嘅工作間度自我隔離。
I think you have a viral infection. My nurse will perform a rapid influenza diagnostic test by a nose swab.
好。
Open your mouth and say ah. Your throat is red and slightly swollen. Now, I'll listen to your lungs. Take deep breaths in and out for me. Your lungs sound clear.
好。
Please wait here. The rapid influenza results should be available in about 15 minutes.
好，希望唔係咩嚴重嘅問題。
Your test results are back, and they confirm influenza A infection.
我聽過流感，但甲型流感係咩？
There are two main types of influenza, A and B. Influenza A tends to be more severe and spreads more easily, especially in flu season. It can sometimes lead to outbreaks and pandemics. Influenza B, on the other hand, is generally milder and spreads more slowly.
我有甲型流感，即係話比較危險嗰種。
It can be dangerous, especially for young children, the elderly, pregnant individuals, and those with underlying cardiopulmonary disease or immunodeficiency. However, most healthy adults recover within a week or two.
有咩治療方法？
Since influenza is a viral illness, antibiotics are ineffective. The main treatment is rest, hydration, and managing the symptoms with medication like Tylenol for fever and pain. You can take decongestants for a stuffy nose, cough suppressants for a persistent cough, and lozenges for your sore throat. These are all over-the-counter medications.
有冇抗病毒藥可以食？我好辛苦。
Yes, if initiated within 48 hours of symptom onset, neuraminidase inhibitors such as oseltamivir or zanamivir can reduce symptom duration and severity by inhibiting viral replication.
我應唔應該食呢啲藥？
Given that you're at the borderline of the 48-hour window, you may still benefit, especially if your symptoms are debilitating. However, antivirals are most effective when administered early.
有冇咩副作用係我需要注意嘅？
The most common side effects of oseltamivir include nausea, vomiting, and occasional dizziness. In rare cases, neuropsychiatric symptoms such as confusion or hallucinations have been reported.
我需唔需要自我隔離？
Absolutely, influenza is highly contagious. Try to stay isolated for at least 5 days or until your fever has been gone for 24 hours without medication.
會唔會引起併發症？
Potential complications include viral or secondary bacterial pneumonia, acute respiratory distress syndrome, myocarditis, and exacerbation of pre-existing conditions like asthma or COPD. If you develop progressive dyspnea, persistent high fever, or altered mental status, seek immediate medical attention.
明白，將來我可以點樣預防呢？
Annual influenza vaccination is the most effective preventive measure. It induces adaptive immunity against circulating strains. Hand hygiene and avoiding close contact with symptomatic individuals also reduce transmission risk.
我今年冇打流感針，真係唔應該。
Indeed, vaccination significantly reduces morbidity and mortality, especially in high-risk groups. I recommend you get immunized next season.
我會，多謝醫生。